Welcome to CSU. We are happy you are here. CSU Health Network is your home for health. We provide medical, mental health, and health education and prevention services to students. As a CSU student, you have access to all of our services. We know that accessing healthcare and using health insurance in the United States works differently than in your home country. This video will provide information about using health insurance in the United States and specifically how your CSU Student Health Insurance Plan, also known as SHIP, will work. In the United States, there is no universal health care, and people must purchase their own health plan to help pay for care when medical needs arise. Even so, when you visit a doctor, insurance will usually not cover all the costs. Most of the time, people will pay some amount when receiving health care. Because healthcare in the United States works differently than in other countries, it is important to define some common health insurance terms. A healthcare provider is a licensed medical professional or healthcare organization that provides medical services or treatments to patients. Deductible is a set amount of money you pay each plan year for covered healthcare services that you have received. Your health plan will begin to contribute toward the cost of care after the annual deductible has been met. Once the plan year deductible is met, you will still share in the cost of your medical care. This is when you may hear the terms coinsurance and copay. Coinsurance is a percent of the cost. You and your insurance plan will each pay a percent of the cost of care that you receive for medical services. A copay is the amount that you pay after your deductible has been met for a particular service each time you get that service. Now we'll talk about in-network and out-of-network care. In-network means that the health insurance carrier has a financial agreement or contract with a healthcare provider, such as a doctor or facility, such as the CSU Health Network. Out-of-network means that the provider or facility does not have contract or have a financial agreement with your health plan. Out-of-pocket maximum is the most you will pay for covered healthcare during a plan year. Once the out-of-pocket maximum has been met for the plan year, you will not owe anything more for covered healthcare during that plan year. Plan year is a 12-month period of time during which deductibles, coinsurance, and copays accumulate toward the out-of-pocket maximum. CSU SHIP's plan year is August 1st to July 31st. Out-of-pocket costs are your expenses for medical care that are not covered by your health plan, including the deductible, coinsurance, copays, or non-covered services. For CSU SHIP, international students have a $500 plan year deductible when medical services are received outside of the CSU Health Network with in-network providers. There is no deductible to meet when you receive your medical care at the CSU Health Network. When you receive medical care at the CSU Health Network, you may pay a low copay for some services and no cost for other services. When you use an in-network provider, you will pay a smaller deductible, $500, and coinsurance, 20%. When you use a healthcare provider or facility that is out of network, you will pay a larger deductible, $1,000 instead of $500, and a greater percentage of the cost, 40% instead of 20%. Because healthcare in the US can be costly, it is most cost-effective for students on the CSU Student Health Insurance Plan to start their care at CSU Health Network if possible. You can think of CSU Health Network as your on-campus doctor's office. When you access medical or mental health care at CSU Health Network using your SHIP insurance, you will have very little or limited out-of-pocket costs. This is because for students with SHIP, the deductible does not apply for services received at CSU Health Network. CSU Health Network offers a variety of general and specialty medical services, including dental, vision, immunizations, primary care, pharmacy, physical therapy, and more. To learn about all of the services at CSU Health Network, visit health.colostate.edu. Your CSU Student Health Insurance Plan is also in network with many providers and facilities in Colorado and the United States to make it convenient to find care at the lowest cost. When healthcare services are received outside of CSU Health Network, students enrolled in the CSU Student Health Insurance Plan will have a deductible to meet and then either co-insurance or co-pays depending on the service received. Specific details about what you can expect to pay under the Student Health Insurance Plan can be found at health.colostate.edu/international-SHIP. As you learned earlier in this video, we encourage you to visit in-network providers whenever possible. If you are looking to find an in-network provider off campus, staff at CSU Health Network or your health plan customer service department can help you. Once enrolled in the Student Health Insurance Plan, you should carry your insurance ID card. It can be downloaded to your phone or computer, and you can find instructions on how to download your insurance card at health.colostate.edu/international-SHIP under the Quick Links section. You should show your health insurance ID card when receiving healthcare so that the healthcare provider can bill your insurance. The insurance ID card also has the insurance customer service phone number on the back if you have questions about healthcare services or providers outside of CSU Health Network. If CSU Health Network is closed or you have an urgent or emergent need, you should seek care at a local urgent care or emergency room. Be sure to bring your insurance ID card. If CSU Health Network is closed and it is not an emergency, the CSU Student Health Insurance Plan also offers online, no-cost medical or mental health appointments 24 hours a day, 7 days a week. More information on accessing online care can be found at health.colostate.edu/international-SHIP. If you have questions about the CSU Student Health Insurance Plan, please call 970-491-2457 or email chuhn_insurance@colostate.edu. Thank you for watching.